multivitamins are not regulated by the FDA, and
No.
not all vitamins are created equal, right? So
Correct. That's correct. And I have to say, every conference that I've gone to and they've talked about vitamins in general, there have been no studies that showed, again, if you don't have a specific deficiency, that multivitamins will prevent disease, prolong your life, or cure any illnesses. With the standard American diet, because there's a lot of fats, it's oils, it's lots of sugar, lots of salt. If you're buying something, it comes in a box and it could sit in your pantry for a year and look the same as when you first bought it. My motto is, if the bacteria and the fungi won't eat it, neither should I. So the idea is to eat real food. But when you drink that glass of orange juice, it takes about 3-4 oranges to make it. So you are getting a lot more sugar.
Mm-hmm.
Yes.
Right.
So what I'm saying is it's better to eat the fruit and skip the fruit juice.
What about sodium?
Well, sodium, excess salt, causes your body to retain more fluid. And if somebody suffers from high blood pressure, the excess salt will cause your pressure to go up even higher. And that increases your risk for strokes. And same thing, somebody with heart disease, you really don't want to add that extra salt.
My hair grows faster than it ever has going whole foods, plant-based. I shed a lot less, and I joke and I'm like, I have so much hair. I didn't need to keep any more hair than I already had, but I shed a lot less, which means, and the hair growth stage seems to stay longer than it did before. How have you seen, for your patients that actually listen to you and they take your advice, what have you seen happen?
Well, definitely I've seen positive changes in their blood work. Like the example I gave earlier, that patients with diabetes, I've seen reversal.
What's going on with our bodies when we are taking a vitamin, which is a super concentrated form of something, versus if we eat it in our food?
Well, let's take iron for an example. When you eat it in food, it's non-heme iron. So your body absorbs what it needs, and you pass what you don't need. Whereas if you're taking an iron supplement that you don't need, then your body retains the iron, and that becomes toxic. And that happens.
In general, just tell us some benefits about moringa.
I do grow moringa, and I do use it. They call it the miracle tree. It's used for protein deficiency in some parts of Africa. It's very high in protein. It's high in vitamins. For example, vitamin A. It's also high in iron.
Attention to your body. Your body is talking to you every single day. And sometimes we ignore those signs and say well, I'm getting older. We expect to sort of start falling apart as we get older. And that doesn't have to be the case. We don't have to be sick.
No.